So I'll just introduce our speakers. We have Emma and Kate on the call. Emma is an adult PCD dietitian in Leeds, and she's been working to develop the PCD service in the north of England. And she's got a keen interest in helping people overcome barriers to achieve healthy nutrition status and in turn optimise their PCD management. And then we also have Kate, who's a paediatric PCD dietitian. It's not an easy phrase, and she's in the management team based at Southampton's Children's Hospital, and she's got a keen interest in selective and sensory eating and helping children and young people with PCD manage their eating behaviours. So without further ado, the floor is yours, Emma and Kate. Please take it away.
Thank you, Katie, and a big thank you for everyone who's joined and who wants to find out more. It's an honour for us to be invited to do a PCD live, so thank you for getting in touch and asking for us to do one. I think they're a brilliant way of learning more, and I recently enjoyed rewatching one on YouTube, the genetics one, so it's great to be doing one on nutrition. It's also an opportunity for Kate and I to talk about an area that we feel passionately about and hopefully spread the word on how PCD might link with nutrition. We do want to highlight that this is all sort of general advice, and if you feel like you would benefit from specific tailored advice, please ask your PCD team or your GP for referral to a dietitian who can then go through in depth your diet and how things could perhaps be optimized. As Katie said, Kate and I have both been involved in setting up our tertiary centres in Leeds and Southampton, hopefully improving PCD care and improving access to this across the country. Our roles involve managing patients with PCD from a nutritional perspective as inpatients and outpatients, as well as helping to develop the service and complete research. Kate and I are also both involved in the UK PCD Dietitians Network, which is where all the PCD dietitians have come together to discuss care, hopefully standardise things and look at how we can improve things, and also with a goal of completing more research, because it's actually an area at the moment that doesn't have a huge amount specifically on PCD. So we're hoping to develop that further. And this presentation will go over what the research is showing currently and also our experiences. So I will get going. In terms of what we're going to cover, we're going to cover a bit about BMI or body mass index and growth, weight management, nutrition support, hydration, vitamin D, probiotics and reflux. I'm going to hand over to Kate to initially talk about BMI and growth.
Hi everyone, as Emma's just said, BMI and growth is a really important factor in PCD management. The BMI, or a body mass index, is a measure which uses your height and your weight, and it calculates whether you have a healthy weight. Now, and they give you a range. So your normal range would be sitting between 18.5 and 24.9. But we do know that people, for example, a lot of rugby players or people with a lot of muscle mass will have a higher BMI. And it's really a case of chatting to your dietitian, and she can look at your physique, your muscle mass, and she can give you a better idea of where your BMI sits. Research shows that BMI and lung function are linked. So a healthier BMI contributes to better lung function alongside your treatments. And we know to get this, to achieve a healthy BMI, you need a dietitian within your multidisciplinary team. All our BMIs are different. So if the BMIs, for example, in children are different to the ones in teenagers, to the ones in adults. Emma, if you wouldn't mind clicking for me. And there's lots of different factors that can affect your BMI. So age is one, for example, another is gender, another is height. Your muscle mass, as I've said, is another one. Your physical activity level and your medical conditions and your ethnicity, which should come up, are all factors that can affect your BMI. Next slide, please. This section focuses on children more than adults. So, for example, if your child has PCD, your child will have a growth chart. Different teams use different ways of measuring and plotting. So some teams might use electronic charts, some might use apps. The main charts that we use in the UK are the two at the top there. You'll see there's blue for boys and pink for girls, where it says Girls UK BMI Index. On these charts, they'll have a section for your head circumference for your little ones. It'll have a weight, a length and a height, and then your BMI on the back, depending on your age. You might notice that sometimes in your children's PCD letters, they might talk about centiles, they might talk about percentiles, they might talk about Z-scores. These are different ways of just noting down the data and looking and telling us how a child grows. So, for example, on the one on the right-hand side with the black block, with the black lines, that shows us percentiles. The darker blue frame on the bottom right shows length, that's the one that says length for age for boys, shows us Z-scores. Your percentiles and centiles are very, very similar. Your Z-scores are slightly differently, and it's just the way they calculate it. What we do notice is that around the ages of about 16, 17, young adults start reaching their adult height, where they stop growing. And what we want to do at that point is make sure that their weights are steady. So their growth at that age will be quite different to a little ones. So for example, under the age of 1 or 2, where their growth is rapid, and they'll go through periods of growth between sort of rapid growth between the ages of 2 and 11. So the stages and their of growth differ during childhood and adolescence. Next slide. Right, so part of achieving a healthy weight is something called weight management. Weight management helps us achieve a healthy weight, but it also helps improve lung function. And you'll hear us mention this quite a bit, the link between a healthy weight, healthy BMI, and improved lung function. Well, we also wanted to talk about what foods contribute to an unhealthy weight. Emma, if you wouldn't mind. Right, so all foods provide calories, and eating too many calories contributes to an unhealthy weight. So for example, if you're a person who doesn't need lots of calories, but you consistently have really high calorie, high sugary, high fat snacks, as opposed to fruit as an example, you will find that you will gain a bit more weight, and that might push your BMI up. So weight management involves controlling the calories you eat to meet your target calorie intake on an average day. And we aim to eat a diet that has sufficient calories to maintain a healthy weight for you. And I think there's one more pop-up, Emma. Oh, there we go. Yep, and different, sorry, just to say that children and older children, so young adults, teenagers and adults, we all have different requirements. So the amounts we eat will all be different. Next slide, please. Right, so what we use in weight management specifically are dietary goals. And one of the things that we look at is something called the Eat Well plate. And you might have seen this online. It's a really clever, nice little tool that we use that takes your plate and divides it into 3 bits. So if you imagine a third of your plate is full of all your starchy carbohydrates, and these are things like your rice, your pasta, your bread, your potato, your maize. So that forms a third of your plate. Another third should be all your fruits and vegetables. So that might be if you have a bit of potato and you have some vegetables and you have a fruit as pudding, that all counts as that section. The other third is made up from dairy, so your cheese, your milk, your yogurt, your proteins, so your meat, fish, your eggs, your legumes, so your beans, chickpeas, baked beans, things like that give you the really good protein. And then a tiny little portion making up the rest of that third will be foods that are really high in sugar and fat. And these are also the yummy foods. So they're your treats, your chocolates, biscuits, things like that. And we want to try and make sure that everybody's meals look very similar to the Eat Well plate so that we get the right nutrients in. If we eat well and we manage our weight, we can help prevent several things. Emma, if you want to. Right, and these would be things like you can help prevent type 2 diabetes later on, heart disease, fatty liver disease, joint issues, for example, so like osteoporosis, fertility difficulties, and reduce stress and balanced mood. And these are not just for patients with PCD, this is everybody. We can all get these kinds, we're all higher risk of developing these sorts of conditions if we don't eat well. Okay, so this is weight management. Emma in a little bit will talk about the other side, which is nutrition support. Next slide.
Okay. So I'm going to talk about the other end of the spectrum, where instead of looking at trying to reduce your weight, you may be looking at trying to increase your weight. And as Kate's already touched on, that might be the reason you may want to do that is because we do know from the research that a healthy body mass index, or a healthy weight, and having good growth tracking along the centiles that Kate showed you, are positively associated with lung function. So sitting in those categories should have a beneficial impact on your lung function, which is starting to show in the research on PCD, and it's heavily supported by the research on cystic fibrosis, which is where this initial idea came from. But why are we seeing some people with PCD having low weights? I will go on to explain that, because there may be increased requirements. So if you are frequently having infections, your body will frequently be having to work extra hard to fight those infections. Therefore, you'll be burning more calories, which can contribute to weight loss. And similarly, if you do have an infection, or you've got a cough, or you're feeling really run down, often you don't massively feel like eating, or things like shortness of breath, changes to senses, or the antibiotic side effects might mean that you don't feel like eating much. So your calorie intake could come down whilst your body's actually burning more calories than normal, which can lead to weight loss or having a lower weight or poor growth. So all of this really reinforces that it's really important for your healthcare provider to monitor your height and your weight, so it can be identified if you are losing weight or you're falling into a low category, which could be a concern, which they then identify we can do something to help this, which should also help your lung function at the same time, hopefully. To give you an idea of the sort of things that you can do if you are struggling with a low weight, there's a few different strategies that we would tailor specifically to people's diets. But one overall idea is something called nourishing fluids. So if you don't feel like you could physically eat more, you can look at adding calories to your overall intake by drinking them. So something like whole milk is a perfect example, because that contains carbohydrates, fat, and proteins, so nourishing things for your body, but not actually having to eat more. If you don't like the idea of milk, you could add a spoon of some sort of milkshake powder. Equally, you could buy a milkshake if you weren't keen on whole milk, like a chocolate flavored one or something. There is also nourishing fluids available that are prescribable, so they could be prescribed by a dietitian or a doctor, which would be, again, more tailored and specific to you, and sometimes used in more extreme cases. If your weight is really low or you're really struggling to meet your nutritional needs, they could be something that would be looked at and potentially prescribed. Another strategy is what we call food fortification. So rather than having to overwhelm yourself and increase your portion size, actually just looking at optimizing what's in your meal. So having extra butter, oil, cream, cheese, mayo, things like that, which you can add in but don't increase the volume, but would add quite a significant amount of calories. Could up it by a couple of hundred, which would help to increase your weight. Other strategies would be looking at things like the moisture content of meals, especially if you've got a dry mouth or you're coughing lots with shortness of breath, actually having more sauces with your meals, or just simply adding a bit of boiling water to make it easier to swallow. And also looking at flavors. If you can be on antibiotics, you can have different taste aversions and not fancy things, so looking at trying something different. And another strategy could be looking at snacking. That's an approach known as eating little and often. So not if you aim to still eat your 3 meals, but also try and have something, even if it's small, in between those meals. So between breakfast and lunch and your evening meal, and also then a snack before bed. It's just increasing that time where your body can gain more nutrition, even if it's something small, and it could be sweet or savory. So you could look at a variety of snack options. I'm going to hand back to Kate now to talk a bit about hydration.
So Emma spoke a little, she mentioned, spoke a little bit about moisture. And the next topic that we're going to talk about is actually hydration in PCD. It's really important because hydration, so fluids essentially, help keep the linings of your nose, your ears, your lungs, your reproductive organs, where all the cilia are, moist, which helps mucosal clearance. What we also wanted to go through was what counts as fluids. Emma, if you wouldn't mind. So water is ideal. This is your best one. But you do have other options that can help make up your fluid intake, and we'll talk about how much you need in a minute. So things like squash, sugar-free squash, or no added sugar squash are good options. Milk or flavored milk, drinking yogurts, smoothies, fruit juice, or even diluted fruit juice, tea, hot chocolate, and flavored water or sparkling water are all options to help you reach your fluid intake over the day. But then we talk about what doesn't count. Now, technically, things like coffee, energy drinks, fizzy drinks are all fluids. They would contribute to your fluid intake over the day, but we try not to have these as much as very often, because actually they're not a great source of hydration. And as I've said, water is the best one, so try and make that the bulk of your drink over the day. Next slide. Right, so in terms of hydration and your fluid goals, so for adults, we try and look at 2 to 2.5 litres. For children and infants, it's a little bit different. So we would calculate, your dietitian as part of your PCD MDT would calculate your child's fluid intake, and it's based on their weight and their age. Children roughly from about 9.5 upwards would need at least 1 litre, 1.5 litres a day to sort of give you an idea. Whereas little ones would manage about 1 litre, 800 mils or so, but it really depends on your child's age and weight. Right, next bit, please. So for adults, like I've said, we want 2 to 2.5 litres. Whoops. We want 2 to 2.5 litres, and then babies will depend on your age, but your dietitian can calculate this for you. There are lots of benefits to hydration. So one of them is it aids digestion, helps all your the food along your intestine move along. It reduces constipation, so you have nice softer stools. I know this is often a problem with children, as they don't want to pass it because the stool is hard, and the water is the thing that helps soften that. It maintains blood pressure and electrolytes. If you don't drink enough, you become dehydrated, you feel quite weak, and this is where fluid comes in to help maintain that blood pressure. It also helps protect your organs, okay, and your kidneys specifically. Next slide.
Okay, so I think that's back to me. I'm going to talk a little bit about vitamin D, which is something that you all may have heard of. We have found in the research that typically there is low levels of vitamin D present in people with PCD. And the exact reasoning for that at the moment isn't clear. It is a common thing that's found in the UK population, but we are finding low levels typically in PCD. But why is that relevant? Why do we need to have a reasonable vitamin D level? Well, vitamin D is made under the skin. It's often known as the sunshine vitamin, and it helps regulate the amount of calcium and phosphate in the body, which specifically, then has a role in having healthy bones, muscles, and teeth. And then it helps to protect muscle strength, prevents rickets, osteomalacia, and falls. And there's growing evidence that it also then provides immunity. We didn't know this previously, but we're now finding which could be especially relevant in PCD. And again, there's also increasing evidence, which people are continuing to investigate, around it reducing the risk of COVID-19 and typically people developing COVID who had low levels. Another reason why we would want to get our levels up. But where do we get vitamin D from? Sunshine vitamin is the clue. The main place is sunlight. That is where we get most of our vitamin D. It is present in some foods, which you can see listed here. So in some fish like salmon and tuna, it's in milk, fortified cereals, cheese, eggs, but it is very low levels. And to try and increase the level circulating in your body from eating those foods would be very difficult. The main source is the sun, which could be an explanation for why we are seeing lower levels in the UK in general. Over the last 50 to 100 years, people are spending a lot more time inside or protecting themselves from the sun, which isn't always necessarily a bad thing, but it does mean that there's less vitamin D being produced. So who should take a supplement? And actually the answer to that is everyone, regardless of whether you have a health condition like PCD or not. The NHS recommends that the general public should take a vitamin D supplement during the winter months at the minimum. So that would be from October to March. We would recommend that you do have your vitamin D level checked annually by your PCD team or ask your GP, just because we have found that levels can be low. And if that is the case, your GP or PCD team can recommend whether perhaps you might need to take a vitamin D all year round rather than just the winter months, or it might be that you need a higher dose, or sometimes we can do a treatment course over 6 weeks, which gives you a big boost, but it would be good to know your level initially before we can do anything like that. In terms of actual doses recommended, babies up to the age of 1 year are recommended to have 8.5 to 10 micrograms of vitamin D a year. A day, apart from if they're having more, worth noting that if they're having more than 500 millilitres of fortified formula, then that won't be necessary because it's in the formula. And then children and adults, actually onwards from the age of 1 year, the dose recommended is 10 micrograms, which is the equivalent of 400 IU. So sometimes on the packaging it might be in micrograms, which is 10, or it might be in international units, which is 400. So if you are looking to pick one up, especially during the winter months, that would be the dose that would be initially recommended, unless you've had your vitamin D level measured and there's more of a specific dose that's been recommended to be you. Where can you get vitamin D supplements? In some cases, the GP prescribes, but over the last year, there's been a reduction in this, and GPs are typically recommending that people purchase vitamin D over the counter, which you can find in lots of different places that hopefully aren't too far. You could get them in chemists or pharmacies, supermarkets, health food shops, and actually in terms of convenience, places like Amazon and things like that online also sell vitamin D. And then if you just look out for the dosing, and the price varies, but it's usually somewhere in the region of £1.50 to £4, depending on how big the pot is that you're purchasing. So yeah, would recommend everyone takes it at least during the winter as a minimum. I'm going to hand back over to Kate.
Muted myself, sorry. So the next thing we actually want to talk about is probiotics, and this is quite an up and coming topic, even with PCD. So probiotics are live bacteria and yeasts, which are considered good bacteria. They live in our guts. They feed on something called prebiotics, which is the plant fiber that breaks down, and these probiotics eat the prebiotics. And then the idea is that you get the beneficial effect on the gut. There is very little evidence on probiotics anyway, and there's no evidence to show probiotics are beneficial in PCD yet. I'm sure there'll be some research coming out at some point. But there are three main types of probiotics that are generally used in the supplements, but there are lots of other different kinds. So your three main types are lactobacillus, bifidobacterium, and streptococcus. But there are also things that we need to consider when you are looking at buying a probiotic supplement. One of those things is the effects of stomach acid on the bacteria. These probiotics, many of them are actually killed when they hit the stomach acid, which means the supplement that you're taking doesn't really give you the benefit that you'd like going forward. Another thing you'd need to consider is, does it have enough strains? Does it have enough strains or enough bacteria? Does it have enough strains or bacteria in that product? And the third thing you then need to consider is, does the product actually have what it says on the box? And this is why when you're looking for probiotic supplements, you look for things like that say lactobacillus, bifidobacterium, and streptococcus. Next slide, please. There aren't any known dosages for probiotics in general, even in PCD. So what you would look at if you chose to go ahead with a product or a drink would be to follow the instructions on the package. Like Emma said, with the vitamin D supplements, you can buy probiotics in chemists, pharmacies, supermarkets, health shops, and online, and they vary in cost. From month supply, generally you're starting at about £10–11 going upwards. There are two main forms. So your one form is supplements. Emma, if you keep clicking for me, thank you. And these will vary based on age. So you'll get ones for infants, ones for older children, ones for teenagers and adults. The products that we've got listed here are merely just for examples. They're not ones we necessarily recommend, but what you do want to look at is you want a good number of strains in those probiotics. So you want something that's got millions and millions and millions of each of those strains in the product. The other option you can look at is dairy drinks, drinking yogurts or kefir, but you also just want to watch the amount of sugar that's added to some of these drinks. So it'd be a good idea to ask your dietitian or to have a look in the supermarkets or where you shop generally, and just have a look at the back of the label. Okay, next slide.
So I'm going to talk a little bit about reflux and gastroesophageal reflux disease known as GORD. You may have seen that written down before. This is the last topic we're covering as well, just to highlight in terms of timings. We have seen specifically in a paediatric cohort study that a lot of people with PCD, so roughly 75%, experience the symptoms of GORD. So these are known as things like heartburn, regurgitation, non-burning chest pain, sore throat, taste change. So that might feel like a familiar thing to some of you guys. In terms of exactly why you might be experiencing that, having a chronic cough can lead to an increased risk of reflux due to the raised abdominal pressures during the coughing, which can then lead to the reflux and aspiration, which can increase the inflammation of the lungs and have that uncomfortable burning sensation that reflux brings on. In terms of what we can do to manage reflux or GORD, there's a couple of options. The evidence strongly suggests that if you have a healthy weight, so ideally not being overweight, then that will realistically lead to less reflux symptoms. Also, smoking would increase reflux. Stress has been found to make symptoms feel worse, so potentially looking at stress management techniques or to try and help improve reflux symptoms. Diet can also play a big role. So these things listed here, like fatty foods, fizzy drinks, alcoholic drinks, citrus drinks, spicy foods, and coffee, are all known to exacerbate or make those symptoms of reflux worse. So if your diet is particularly high in any of those, potentially looking at significantly reducing them or removing them may help to remove reflux symptoms. And it's just worth noting that that needs to be done continuously rather than just a one-off. You're not likely to see an improvement in your reflux unless you can consistently have a reduced amount of these things. There's a couple of things you can do which might have a positive impact on reflux. So ginger is being shown to help to speed up stomach emptying, so that might help to reduce symptoms if you have a diet with a bit of ginger in or extra ginger on what you may already have. Fiber has also been found to be helpful, so things like fruits and vegetables, legumes, pulses, seeds, wholemeal things, and also going for more of a little and often approach. So rather than overloading and having really big portions, smaller portions should mean less reflux. There's also a way of managing it medically using medications, which some of you may already be on. Proton pump inhibitors, which you might recognize the name omeprazole, can help to reduce symptoms, which would be discussed with your doctor in terms of prescribing these, and also some over-the-counter medications, again, which you may be familiar with, which help to reduce the acidity of the stomach acid, so therefore you don't have that horrible burning feeling with them. So things like Gaviscon, Pepto-Bismol and Rene could all help to hopefully reduce those symptoms of reflux. And then Kate's just going to talk a little bit about the references and resources that we've listed.
So we wanted to put these links in. We know our patients are very dedicated to their health and nutrition, and we wanted to give you these links in case you wanted to have a look at them a little bit further. The NHS has provided brilliant resources. So one of the things, for example, is a BMI calculator. and there's a bit more information on your body mass index. There's the Eat Well guide, there's how much water you should be drinking, there's information on vitamin D and probiotics. What we've also included in here is the research that we've used. There is not a lot of research on patients with PCD, but we've included the main ones. You may recognize them from before, but there's a really good article on vitamin D and PCD. There's one where we characterize the nutritional status of children with PCD, and there's one, the growth and nutritional status and their association with lung function, and they're all really well cited. All right. I think we've got some questions going forward.
Yes, we have quite a lot of questions. I hope you're ready. And just to tell everybody on the call, I can send everybody these slides if they'd like, or if you don't want the slides, well, I don't have to send you them. I can either just send everybody them, or you can send me an email, whatever you prefer. It's easy to do, and then you can get all of these links of the references as well if you'd like to read a bit more. So first off, we have to start with a question about mucus and dairy, because we always get this question. Is there a link between mucus production and dairy products, and that you should avoid dairy, or is that not true?
Can I answer this one, Emma? Or you?
Yeah, go for it.
I can't. Right. So not formally. So we did a little Twitter announcement a year or two ago, and one of the things that we looked at was PCD and dairy. Now, I know historically there are, anecdotally, there is some people feel that if they have a lot of dairy, it increases their mucus, but in the research, there is no link. And I think it's a case of talking to your dietitian a little bit more about that, and maybe she or she can make some tweaks if you feel this is an issue.
That nicely moves me on to the next question, actually, which is, I had a couple of people ask this one, but they haven't actually currently got any dietitian advice or assistance, and they think that they would like to, either their BMI is a bit too high, or their BMI is a bit low, or they think they're lacking. What is the best way for them to get assistance, and how do you get in contact with people like yourselves for patients with PCD in the UK?
So we would recommend, if you have good contact with your PCD team, speaking to them whenever your next appointment is, and they should be able to direct you. But another option as well is speaking to your GP, and they should be well aware of community input, or local input could be from dietitians, or if there's potentially a PCD specialist dietitian that would be available in your area as well. So the main people would be your PCD team, like the doctor, and then your GP.
Brilliant. Yeah, that's my advice as well. Sometimes it might be quicker to go through one route or the other.
Yeah.
So just, I guess, try both and see what you get, really, would be my advice. Brilliant. So next question is about vitamin D. It was actually a couple of questions about vitamin D, but I'll start with this one that's asking, is it better to take a really strong dose or a higher dose for every now and again, so let's say every other month or something, or is it better to take a smaller dose every single day? What would be your advice?
Are you happy for me to? I'll take it, Kate.
Absolutely. Yeah. Go for it.
The recommendation is, especially during the winter, is to take a daily dose. So to have that regular top up of the vitamin D is, I would say, the best option. Yeah. However, what I do talk about to patients, some people really struggle with compliance and adhering to daily tablets. And if you feel like that's just something that's just not going to work for you, then it would be better to buy a higher dose supplement that you could maybe take every Monday, for example. But the more frequently, the better. So actually having the lower dose every single day is definitely the best option. But if you just think, I'm never going to remember, we'd prefer you to buy a slightly higher one and then take it once a week, for example, if that could be, but as frequently as possible is better.
And it's finding little strategies. So for example, if you are one that frequently forgets, like I hate taking vitamin tablets, but put it, for example, if you put it in the bathroom, on the bathroom sink next to your toothbrush, and you have it before you brush your teeth, it's a nice reminder that actually it's there and you need to take it, kind of thing, and that helps you get better at taking them.
Agreed. Yeah, so I have it near my nasal sprays and my inhalers, so I do that every day anyway, so I'm in that routine, so I'll put it next to something I have to do, and then that reminds me to do the things that are new. Another question on supplements in general, do you also recommend taking other things, so like omega-3 or other vitamin tablets in general, or is that a more specific case by case?
I think that would be specific to the person and their diet. So, for example, if you eat generally, you eat oily fish quite regularly, chances are that you are getting omega-3. A lot of our patients take multivitamin and mineral supplements, and a lot of those have omega-3 added. I know a lot of my patients will have omega-3 as an additional option, and that's their choice. There is not loads and loads and loads of research on omega-3, and I haven't come across any in PCD. Emma, I don't know if you know any within CF patients.
No, it's not something typically recommended. The only thing I would really recommend is a multivitamin if your diet isn't very varied in adults. So if you're not having huge amounts of fruits and vegetables, then I would recommend an over-the-counter multivit. But if you are having a balanced diet, there is no need for any, the research currently suggests there's no need for any additional supplementation apart from vitamin D.
Brilliant, thank you. Another question we have about antibiotics in general. So there are a few people that I know and somebody that has messaged that when they have antibiotics, sometimes they get thrush. And is there anything that you can do to help diet-wise to prevent thrush happening? And also, is sugar something that's not recommended and unhelpful? So quite a few questions there about that.
Emma, do you want to take this one?
Yeah, unfortunately, there is no research link there, and there is nothing at the moment that is shown to have a beneficial or a negative impact on thrush. So there isn't any changes or tweaking that we'd recommend people do. It maybe would be useful if there was, because it might help things, but there isn't.
But if you know that your diet is loaded with unhealthy takeaways and loads of sugar, there might be a benefit to making that a little bit healthier as well, getting more fruits and veggies in, good proteins.
Yeah, there's always, that's always beneficial, definitely.
Great, thank you. On probiotics next. Thank you so much for putting some information on that, because that's always something that I think about as well. But would you recommend that we take them all of the time, or would you recommend that you only take them on antibiotics, or will you do more when you're on antibiotics or after?
This is a tricky one, because there isn't any research that shows that, is there?
No.
And I think taking probiotics on a daily basis is a really individual choice. We leave it open to our patients if they'd like to start probiotics. And whether you take them with, or like when you have an antibiotic and you take I know some medical teams might feel a little bit differently about that, but that's something you could ask them as well. Okay.
Yeah. It's really difficult with probiotics, because as Kate said, there's so many different types and different strains and different quantities that it could be that you might choose to spend your money on a probiotic and give it a try, but that one specifically may have no positive benefit to you. Another one might, but there's no clear evidence to say take this one or don't take that one, because everybody's gut bacteria is different. So it's quite difficult for anyone to make recommendations, especially when it's purchasing it yourself. And I have some patients who do take it, especially during and after courses of antibiotics, because they feel it's beneficial, but it can be quite difficult to find one that you feel that benefit from.
Yeah, that makes sense. It's too many choices sometimes.
Yeah.
Isn't there? We also have a question about keto diets, and would you recommend this for PCD patients or people in general?
So this is a bit of a loaded question. I think one of my other specialties that I deal with is actually ketogenics. But the ketogenics that I deal with is medical ketogenics, which is different. So we use this for children with epilepsy. I think the keto that Noor might be talking about is like the general keto diet for weight loss. There is no link between that kind of diet and PCD. However, you can use sort of the keto diet, some sort of elements of that to help you lose weight, which would be beneficial in PCD if you were overweight or obese. Okay.
Yep.
But it might also be useful to chat to your medical team. So for example, if you have really high cholesterol, we don't generally recommend a keto diet for things like that, because it's different to the medical keto that we would, it's that the two kinds are very different.
Okay.
And the amounts of fat and carbohydrate that you eat are different for both. So have a chat with your medical team before you would go on something like that.
Well, I think that's all the questions that I have been given. So I'll just give anybody else on the call opportunity to ask any further questions. And if they don't want to write them in the chat, feel free, you can unmute at this point and ask your question directly. So we'll just have a little awkward pause and wait.
Everyone's probably dying to go off and have their evening meal.
I know, and the sun's out, so thank you ever so much, everybody, for joining us on such a beautiful sunny day.
Yeah.
Thank you for giving us the opportunity to speak. It's been really great.
Yeah, I think it's definitely needed. A lot of people do come to the charity and ask about diets and nutrition, so I think it's been very helpful to have you. In which case, as no one's volunteered themselves, we'll wrap up there. I will send these slides out to everybody, and as you've noticed, we are recording this, so I will upload this to our YouTube account in due course, so you can rewatch it again and share it with anybody else that possibly missed it and would benefit from listening in. We have a little bit of a break for PC Live because of the summer, so we may have another one next month, but I haven't pinned down the dates yet. But we will have some more on transitioning from paediatric care to adult care. We have PCD diagnostics, we have physio techniques, we've got a talk lined up on fertility, and we also have a talk on ENT, so sinuses and hearing and things. So we've got loads of exciting information coming your way. But as always, if you want to hear something specific, please do just get in touch. I will put my email in the chat. So my name's Katie and I do the comms support, so give us an email if you need anything. And thank you very much. Thank you, Kate. Thank you, Emma, for your time. It was a wonderful talk.
Thank you, Katie.
Thank you, Emma. Great team.